Good afternoon, and welcome to the MIT COVID-19 Latin America Challenge. We are very excited and grateful that you guys have come together with us this weekend to try to find some solutions for COVID-19 in our region. My name is Miguel Paredes, and I work for Peru's largest insurance company, Rimac Seguros. I am the Executive Vice President for Artificial Intelligence and Data, and we will be presenting the first track in the COVID-19 Challenge. And we hope that you guys, a lot of you will join in this track and try to find solutions to try to identify and who are the immune COVID-19 people in our populations. Where are they? And also, how do we identify those people who are infected and are maybe unaware of it or are asymptomatic? The best strategy to fight COVID-19 is to identify and isolate, right? And in that sense, we need to come together to develop new and reliable methods to identify, to test, and to trace. This is fundamental if we are to halt the spread of the disease in Latin America and to prevent more and more havoc that is occurring. We need to identify immunity status as well. We need to, in order for people to return safely to the workforce. The virus is affecting our health, but the quarantines and the isolations at homes are also affecting the economies and the livelihoods of many people in our countries. This is really hard. It's not a hard solution to find. So we need you guys to work on this. So what are the new technologies that we can use to achieve these goals? How can we identify, how can we predict the spread in certain locations? The unit of analysis, many times reported by countries, is very aggregate. How do we start getting at a finer grain level, district level, county level? How can we really understand how many infected people are in an area? There's many public data sets of this. And how do we infer and identify people that are potentially infected in those areas so that we can work on trying to test and isolate and also help. We need to isolate but help those people. The government needs to jump in and try to find ways to prevent them from having to go to the markets or trying to get some money to be able to feed their kids, right? So we need to support them as well. How do we tackle and manage the silent risk of asymptomatic and unaware infected people? This is a very hard problem. Much of the problem here in Latin America, and at least in Peru, has been that a lot of people are asymptomatic, which is common in this with COVID-19 disease patients. And they're spreading the disease, not willingly, not wanting to, but they're just unaware of it. So how do we optimally and intelligently test people throughout Latin America? And this is a very strong challenge for Latin America because there's a scarcity of tests. And we need to find a way of optimally testing. So any insights in trying to identifying where we should test and where potentially the asymptomatic and unaware people are would be super helpful. Finally, how can we estimate how many have been infected, where they are, locate them, and try to help them is fundamental for this. So thanks again, and we hope to have many of you guys participate in this challenge. Have a great weekend.